Welcome back. My name is Dr. Carl Baird, and today I'll be guiding you through a 15-minute strength workout for knee pain. So the purpose of this workout is to help you improve movement and build strength to help limit impact that goes through your knee so that you can keep active and maintain your lifestyle as you get older. And the key is that we do it in a joint-friendly way. So we strengthen the muscles that we need to strengthen to support our knee without aggravating our knee further. And so that's what we'll do today in today's workout. I will guide you through everything. And the only equipment that we need is a step up of some sort. So I'm going to use a yoga block, but anything that you can use to perform a step up will work. And a box or a chair if you have it, but not 100% necessary. So let's go ahead and get into the workout. Building strong glutes is a cornerstone of solving knee pain and helping you keep active as you get older. So let's go ahead and start with glute bridges. We're going to work our way onto our back, knees bent, feet flat on the floor. You can have your arms just out at the side here. And from there, all we're going to do is press through our feet to lift our hips up into the air. You can do a quick squeeze at your glutes. Make sure that you feel it in those big glute muscles and back down. So a couple things to look out for when we do this exercise is the placement of the feet. Again, we want to feel this in our glutes. If our feet are too far out, you might start to feel it in your hamstrings or even your low back, or if they're too close in, you might feel a stretch or a pull along your quads or the front of your thighs. So you want to find that nice middle ground where you're at the top, you really feel it in your glutes. But again, keeping it nice, slow, and controlled so that we don't aggravate anything we don't want to. Good job. Okay, now we're going to work our way onto our side, and we're going to do a clamshell. So this one I can use my bottom arm as a nice little pillow. I'll have my knees a little bit out in front of me with my hips, knees, and feet stacked. And from there, I'm just going to lift this top leg here. And so this again is targeting another muscle in our glute complex. It's called your glute med. And as we get further into the workout, you're going to feel the burn on the side of the hip here. So this glute med is another one specifically for knee pain that's really important to strengthen. And it's not a muscle that we use a lot in our day-to-day routine. So for a lot of people with knee pain, this muscle is particularly weak. And you'll probably start to feel it. I'm already starting to feel a little burn here. And again, if you're feeling like it's too easy, the other thing that you can do is just add a band around your knees. We're going to go through this again. And so on the next round, you can just add a band if you feel like you want to challenge yourself more. One last one here. Good. All right, let's go ahead. You can just roll over. I'm going to flip onto the other side, and we're going to do the same thing for our left side. So again, my knees are a little bit in front of my body, hips, knees stacked, and again, bottom arm is a pillow. And we're just lifting that top leg here. So again, relatively straightforward exercise. The only thing that you are looking for is that when you open up this top leg, you want to keep all the movement in your hips. So I don't want to open up so far that I start to round at my low back. It's really important that you keep it in the hip, even if that means you don't go quite as far. That's totally fine. Another thing you can pay attention to as you go through this is, again, does one side feel harder than the other? So I can already tell my left side is starting to burn a little bit more than my right, which would suggest a little bit of an imbalance side to side. Again, not always a huge deal, but it's something to pay attention to and something that we want to correct. Good job. Let's go ahead and do one more. And done. So now we're going to go ahead and work our way to a standing position. I'll meet you there. So let's go ahead and start round 2 of our workout for knee pain. And again, we want to keep things very simple. So we're just going to come back to that glute bridge. So lay on our back. Knees bent, feet on the floor, hands can be at the side. And from there, we're just pressing through our feet to lift our hips up into the air. We're keeping it nice, slow, and controlled, and really making sure that at the top, we feel it in our glutes. So you can squeeze at the top, and you really should feel those glute muscles be nice and engaged. Again, if you're feeling it in your low back or your hamstrings, maybe just try pulling your heels a little closer to your hips and see if that helps. If you're feeling it in your quads, maybe put your heels a little bit further away. We really want to keep this directly in the glutes, because building strong glutes, again, like I mentioned in round one, the cornerstone of solving knee pain and keeping active as you get older. Nice work. Okay, let's go ahead and move into our clamshells. So we'll roll onto one side. Reminder, we've got our bottom arm as a pillow. Knees are a little bit out in front. And open up that top leg. So another reminder that this is targeting another muscle of our glute complex instead of the glute max, which is kind of the big meaty muscle surrounding our hip. This is the glute med, and it lies on the outside of the hip. And again, a very important muscle for knee pain. One thing you can tell is if this muscle is weak and we're standing on one leg, if that knee, and you start to bend down and that knee starts to cave in, that would suggest that there's weakness in this glute med. And it's something, if your knee is caving in like that, that's putting a lot of impact on the structures at your knee, and it's probably contributing to your knee pain or arthritis. Whew, starting to feel the burn again. Round two, things are a little bit harder than round one. That's what we want. Good job. We're going to do one last one, and then we'll switch to the other side. Good job. All right, let's go ahead. You can just roll over. I'll go to the other side, and we'll get ourselves set up. Knees slightly in front of the body, and just lifting that top leg. Nice work. Main thing is, again, keeping your body nice and aligned. You can kind of, whatever you want to do with this hand, just rest it at the side. But the main thing is the movement is taking place right at the hips, and that we're not opening up so wide that we start to rotate and our shoulders turn back. Good job. And again, paying attention. Is one side weaker than the other? Just the more you know about your body, the better. Everybody's a little bit different. No right or wrong, but if we know we're weaker on one side, we can start to pick exercises that help strengthen each side individually to help improve that imbalance. This is particularly true if you've ever had a surgery on a leg, on a knee, on an ankle, on a foot. Odds are one side is going to be a little bit weaker than the other. And done. So let's go ahead and move back into our standing position for the second round of our standing exercises. Okay, so now we're moving into the standing portion of our workout, and we're going to start with an exercise called toe tap. So to perform this exercise, I'm going to stand on one leg with a slight bend at my knee. Just make sure that knee isn't locked out. From there, I want to balance on this foot and take my opposite foot and tap it directly in front of me. Come back to the middle, tap to the side, back to the middle, and straight back. And then we're just going to repeat the whole thing over again. And so the goal of this exercise is to balance as much as we can on the stance leg. So we'll be feeling the work in that glute med and the side of the hip of this stance leg. So this is something, it improves single leg strength, improves glute med strength, and obviously if you have trouble with balance, you might notice that it's going to help improve balance as well. If you find yourself kind of shaking and losing balance, totally okay, totally normal, just reset and get right back into it. And the more times you go through this workout, the easier it will get. Okay, good job. We're going to switch to the other side. So again, now I'm standing on my right leg, slight bend in that stance leg, making sure it's not locked out. And we're doing the same thing, tapping in front, back to the middle, tap to the side, back to the middle, and straight back. So again, you'll also notice I'm not reaching as far as I can. It's just as far as your foot can naturally go, because the purpose of this whole exercise is to work that stance leg. So stand as long as you can. So again, nice, slow, and controlled. We don't want to lose balance and fall out of it by trying to go too fast. We're really going for a minute of just simply standing on this leg. And again, you'll start to feel the burn in that glute med, up the entire leg, and improve balance. On the next round, if you want to make it a bit harder, you can hold some dumbbells at your side. Adding a little bit of resistance is going to make it harder. But even me, without any weight, I do feel that burn on that side. Nice work. Okay, so next we're going to move to what is called a box squat. And so the reason I would like you to have a box available is because it gives you options. Everybody's starting point is going to be a little bit different. So what a box squat looks like is I have the box to the chair right behind me, and I just send my hips back, tap my butt on that box, and stand back up. So a few options with the box squat is you can do a quick tap and come back up. If that's feeling too difficult, you can sit all the way back down and then press up. But the goal is to work your way to a point where you're simply just doing a quick tap and coming back up. So the squat is a really great leg strengthening exercise for knee pain. Adding the box to it is a great way to just keep it a little bit safer, limit the impact that goes through the knee as you perform this exercise until you have enough strength to do an air squat without the box. Nice work. Okay. And next, we're moving to the step up exercise. So this is where we do need something to step up on. So I'm just going to use this yoga block. You can use a stair or anything you got at home. If you have a significant amount of knee pain, I would start with a very low height and then work your way up. So this one yoga block is about 4 inches. I'm going to place my left foot on the block and then press through to stand up. So again, the main thing here is why I like this exercise is you have a lot of options. So if you're somebody who is experiencing a good amount of knee pain, then start with the lowest block and perform. If you're feeling more strong and confident, you can make it harder in 2 ways. You can pick a higher step or use the lower step but hold dumbbells on each side. And again, this is another great exercise for single leg strength, strengthening in that glute med, and working on balance as well. The main thing is that you're pressing up off the top leg and you're not toeing off the back leg. That's a common compensation if you are struggling with knee pain. Your body's trying to protect your knee and so it cheats, which is not what we want to do. We want to strengthen this leg as much as we can. Good job. Let's go ahead and switch to the other side. So now I have my right leg on the block and I'm doing the same thing. Again, if you're dealing with knee pain and arthritis, the key is slow and controlled. So it's not about how many reps we can do in a minute. It's about safety. So just making sure that we don't do anything to aggravate our knee pain. Another tricky thing about step-ups is, again, if you do have knee pain or arthritis, you might feel a little bit of knee pain, discomfort, not feeling confident in this top leg. But I would encourage you to just kind of go through the movement anyway. Sometimes that pain is just a protective mechanism of your brain. This is a really low impact movement, so not a lot of force is going through the knee, but your body can create that pain signal because it's trying to protect you. But the more we do it, that pain signal will start to go away and you're not doing any more damage to your knee. That's a common worry of many people. All right, nice work. So we've just completed round 1 of our workout routine. So if you need, you can hit pause, take a quick break, but then I'll meet you back on the mat for round 2. All right, we're ready for round 2 of our standing workout. So we're gonna start with toe taps. Remember, I'm standing on my left leg. I got a slight bend in that knee, so it's not locked out. And then I'm just tapping in front, back to the middle, tap to the side, back to the middle, and tap straight back. So the key is to try and balance on your stance leg for the entirety of the 60 seconds. And that's where you're going to feel that burn. If you are struggling with balance, it's okay. If you fall out, just get right back in. The other thing that you can do is stand next to a wall. And again, you don't want to lean on the wall, but it's just there. If you find yourself falling out of this a lot, every time you start to wobble, you can kind of put your hand on just to reset. And the more you do it, the easier it'll get. I know balance is probably the most frustrating thing for a lot of people to improve. It just takes consistency and repetition, but the stronger you get, the better it will become, I promise. Nice work. Okay, let's go ahead and switch to our right side. So same thing, slight bend in my right knee, and we're tapping front, side, and back. Nice work. Again, round 2, always a little bit harder than round 1. If you wanted to make this one harder, if you feel like this is too easy, just adding dumbbells, whatever weight you find challenging, as long as it doesn't cause you, again, to lose balance and fall out of it. That's the beauty of building strength to solve pain. It's finding that sweet spot where an exercise is challenging, but it's not dangerous, or it's not going to do anything to aggravate that knee pain. But everybody starts at a little bit different level, so I try to give you options because don't want it to be too easy, don't want it to be too hard. All right, we're almost done. Let's go through it one more time. Front, back, and to the side. Nice work. So let's go ahead and move into our box squat. So again, we're just standing in front of a box or a chair. And from there, I'm sending your hips back and doing a quick tap and standing back up. If you need to, you can sit all the way back down and press through the knees to stand up. Just make sure that when you're doing that you're not using your momentum to round up. Because again, we want to use the strength of our leg muscles to get us up, not momentum of rocking back and forth. Nice work. Another thing, maybe you feel a little bit of knee pain with this that you can play with, is the position of your feet. Maybe try to go toes out and focus on pressing your knees out as you perform the box squat. I found a lot of people, whenever they're taught to squat, we're taught hip width, toes pointed forward. It's not always the case. Everybody's a little bit different. You can try widening your stance, pointing the toes out, and that helps a good amount of people. Nice work. Okay, then we'll finish up. We just got one more exercise, a step up each leg. So let's go ahead and grab our block. Start with our left foot and press up off that left foot and back down. So again, easiest variation is a low height, no weight. If you want to make it more challenging, you can do a higher step. Again, just making sure that it's not aggravating your knee. And if you want to make it even more challenging from there, you can add weight to this movement. So just holding 2 dumbbells on each side is going to add more resistance to make this exercise more challenging, which is what we want to do. We want to continually challenge ourselves. That's how you build strength. And the more strength you have, the less impact that goes through your knee, the less knee pain, the less knee arthritis, and the added benefit is that it helps build confidence in your body's ability to do the things you want. Because what I found from my years of practice is it's not always the pain that keeps people from doing the things they want. It's the fear, the not feeling confident. And that's why I love strength training. Let's go ahead and switch sides. Pressing up off the right foot now. Is that it helps you build confidence in your body's ability to do the things you love. And it's really the only treatment that does that. You can take pain pills, you can get injections, you can have surgery. All those things may or may not help with your pain, but it does nothing to improve confidence in your body's ability to do the things you love. It just masks the pain so you can get through it, but that nervousness is already there. But if you really focus on building strength, you'll notice that as you go for a walk, as you climb stairs, as you get back into hiking, whatever it is that you want to do, you'll feel a lot better and more confident. And that makes these things more enjoyable, which is the whole point. That's what we're trying to accomplish. Just help you get more enjoyment out of the world. Because when you're stuck in constant chronic knee pain, it can really suck a lot of that enjoyment out. So nice work getting started on this journey. All right, let's go ahead and do one more. And we're all done. You finished our 15-minute strength workout for Congratulations on finishing your 15-minute strength workout for knee pain. Just as a reminder, the goal is to improve movement and build strength to limit impact on your knee for less pain, less arthritis, and to help you keep active and maintain your lifestyle as you get older. So one of the more common questions I get is how often you should be doing this workout. If you do want to add this into your routine, I recommend every other day is a good frequency. Do that for 2 weeks. And ideally by then you have a nice strength foundation that we can move you to a more challenging variation, or you can add some of the variations that we talked about in this video, like increasing the height of the step up or adding weight. So that's all I got for you today. Thank you so much. If you have any questions, leave them in the comments below.